Hi, I'm Lydia Straka, and I will be talking about my senior honors thesis in anthropology, which is titled Dutch Childbirth Narratives, Women's Perspectives on Physiological, Biomedical, and Woman-Centered Approaches to Maternity Care in the Netherlands. So my research looks at lived understandings of childbirth in the Netherlands and sees how these do or do not align with the notion of Dutch physiological birth. I became interested in this topic when I studied abroad on an SIT program in Amsterdam, and I also have a personal interest in maternal health care, with most of my background beliefs coming from my understanding of how the United States, their extremely medicalized childbirth culture can harm parents and children. For instance, it has been shown that this approach contributes to high C-section rates, iatrogenic harm, and this domino effect in which one intervention can necessitate another and another. It's also been debated if this might have something to do with postpartum depression, and there are even some cases of PTSD from hospital births. So the Netherlands is notable for being one of the only high-income countries whose culture of maternity care consciously discourages unnecessary interventions. And in maternity studies, this is described as physiological birth. And really what it is a foil to biomedical birth. So for example, the Dutch home birth rate is actually 13 times higher than the United States' rate, along with the Dutch system having notably lower cases of induction, C-sections, and epidural use. And another way that their maternal health system is very different from the US is the use of midwives. Midwives in the Netherlands are the go-to maternity care providers. And this all occurs while maintaining the safety of patients and their children. So this has led many academics and activists to admire Dutch birth culture, and many have proposed that physiological birth is exceptionally woman-centered. So despite physiological birth receiving a lot of attention on a global scale, I found little to no work in English that holistically sought to understand women's beliefs about childbirth in the Netherlands. Asking questions like, do they appreciate physiological birth, or do they feel that their subjective needs are not being met? Dutch childbirth practices, on top of all of this, have actually become increasingly medicalized over the past few decades. Their home birth rate actually went from 68% in 1965 to 24% in 2000 to 13% in 2014. And in other high-income countries, for which I was able to find the data, their home birth rate has actually increased. So there's this really different pattern of change going on in the Netherlands. And this gave me all the more reason to produce current research about Dutch women's experiences and belief systems with maternity care and childbirth. And my thesis fills this gap with a handful of personal interviews that offer an intimate look at women's birth narratives. All of the mothers I interviewed were not native to the Netherlands, and this added another layer to my research in the context of Amsterdam's increasingly global population. So what I found is that my informant's collective beliefs did not clearly map onto physiological or biomedical childbirth paradigms. Instead, what they offered was an alternative ideal rooted in woman-centered care. And they described this as maternity care that provides unbiased information about a variety of options, and that also allows them to exert choice and control over childbirth. And what they based these desires upon were their deeply held beliefs that labor and delivery can unfold in a variety of ways, and also that it is important to feel calm and safe during birth. So each individual woman, her desires with respect to physiological and biomedical philosophies did fall along this spectrum. But what I concluded from this was that any maternity care system that adheres strongly to physiological or biomedical practices is not woman-centered, because it will always fail to offer services that can fully encapsulate the range of women's personal desires. Informed consent also came up as an integral practice, a way to ensure that women are presented with the information they need in order to make safe decisions. It's really this way to balance the need for medical expertise along with women's rights to have options and make choices for their birth plans. So overall, rather than being primarily concerned with medical versus physiological birth, as so much research is, my findings present this alternative scale of woman-centeredness by which to judge a birth culture.